Ciao Mondo, hello world, hola mundo, hello Mondo. We're here at the 40th anniversary International Vicenza Course on AKI and CRRT, and I went with my friend Shacham from Israel, who won the Best Abstract Award with an abstract entitled AKI Recovery Patterns in Patients with ST Elevation Myocardial Infarction. So Jacob, can you describe briefly your results, and congratulations for winning the Best Abstract Award?
Thank you very much. So we investigated the clinical relevance of AKI recovery patterns among a large group of STEMI patients which were admitted to our ICU. From a group of nearly 3,000 patients, we identified 255 patients who developed AKI based on the KDIGO criteria. These patients were further stratified into patients who had AKI recovery versus patients with no AKI recovery. The patients were followed up for the occurrence of in-hospital complications, long-term mortality, as well as long-term renal outcomes. We observe a graded increase in the occurrence of in-hospital complications between patients with no AKI, recovered AKI, and non-recovered AKI. Not surprisingly, patients with non-recovered AKI demonstrated the worst long-term mortality. However, even patients with recovered AKI demonstrated a twofold increase in long-term mortality. With respect to long-term renal outcomes, over a 90-day follow-up period following the AKI event, 52% of the patients with non-recovered AKI failed to return to their normal baseline creatinine, thus demonstrated progression from AKD to a new stage CKD. However, even patients with recovered AKI, 17% of whom demonstrated the new worsening of their renal function, albeit normalization of renal function at hospital discharge. So we can conclude that among patients hospitalized in the ICU, AKI recovery pattern is a valuable prognostic marker, and even patients with recovered AKI allied with worse in-hospital outcomes and prone to relapse.
And the reason for this can be that recovery can be apparent because part of renal functional reserve can be lost in this situation, and so they increase susceptibility to other major adverse kidney and cardiovascular events. With this, thank you very much for joining today, Cappuccino, and have a wonderful day.
Thank you very much.
Excellent.
Excellent.